Today is Women's Brain Health Day in Canada. It's a day aimed at drawing attention to the differences in men's and women's brains. It's been decades since scientists recognized the differences between heart health in men and women, but only about 10 years since doctors realized there are substantial differences in the brain, such as the processing of pain. Joining me now is Sarah Widmeyer, board member at the Women's Brain Health Initiative. Sarah, thank you very much for joining us this morning.
Thank you for having me.
Let's talk about the impact first Alzheimer's has on women and women's brains. Obviously, there is a noticeable difference in the number of people who get Alzheimer's, male and female.
There is up to 70% of the sufferers of Alzheimer's are women. It is primarily a women's disease, unfortunately.
And any indication, or this is what the research is about, is there any indication for why?
This is why the research is so critical. And it is why Women's Brain Health Initiative was born over a decade ago to draw attention to this and to help empower women to take charge of their brain health and explore with research. And we need to fund that research as to why the differences exist.
Are we starting to see reasons? We slowly starting to figure out this puzzle?
You know, I'm not a medical professional, but I would say that, we're starting to understand that there are things that you can do, like lifestyle changes. Up to 40% of Alzheimer's cases can be delayed or prevented if we make some basic lifestyle changes. So certainly the research is figuring that stuff out.
Let's talk a little bit about that, the brain health and some of the things you can do to push it back, hopefully.
So we call it the 6 pillars of brain health. What I would tell you basically to remember is that whatever is good for your heart is good for your brain. So things like exercise. You knew I was going to say exercise. Exercise, sleep. Sleep is so critical. Reducing stress, having a diet rich in phytonutrients. There are things that we can do around social stimulation that is super important, which, as someone has Alzheimer's, becomes more and more important that they have the social interaction because it keeps the brain functioning and keeps you stimulated.
And this is so important. You have a very personal connection to this.
I do. I lost my mom about a year ago to Alzheimer's. My dad passed in May 2019 after a prolonged journey with prostate cancer. And so we really weren't focused on my mom. And so mom's diagnosis came shortly after dad died, which is when we started to really focus in on her. And she declined very rapidly. And I suppose that was a bit of a blessing because Alzheimer's, as a loved one and as a caregiver, it is devastating to watch someone that you love go through this. And I describe it like you grieve the person as in every interaction that you have up until they pass, and then you grieve all over again. It's a very tough journey for a caregiver.
Sarah, I appreciate you sharing that with us.
Thank you.
Sarah Widmeyer is board member at the Women's Brain Health Initiative. Thank you again for your time.
Thanks very much.